Good afternoon. Thank you for joining us today. We'll give a brief update on a couple things, walk through the slides. We'll hear from Vice Chair Vargas, and then Drs. Wooten and McDonald are on hand for any questions. We continue to work our way out of COVID-19. We obviously saw progress this week with San Diego County now officially being in the red tier, which we know is welcome relief to restaurants, gyms, museums, zoos, aquariums, and retail and shopping centers. We do want to encourage the public. We want to continue to be cautious. We want to be careful. We want to make sure we have a smooth and steady recovery, but we are encouraged by the direction and what we are seeing. We're also encouraged, although supply of vaccines does not exist to meet the demand, we are encouraged. Our allocation for next week is about a 10% increase over what we have this week, and we've been holding steady or stable for a considerable amount of time, and it's not the increase we would like to see. We would rather have a doubling of the number of vaccines, but I think it does begin to show that the supply is beginning to uptick, and so we are encouraged in the coming weeks those numbers will continue to climb. However, we ask for the public's continued patience between our food and agricultural sectors and education and child care, along with those with underlying health conditions. There is going to be a shortage of first dose appointments in particular until the supply increases significantly. And so we ask for everyone's patience. We can only make appointments available for vaccines we receive, and we have no control over the supply of vaccines. So we are headed in the right direction. We are encouraged. It is a very good step to be able to open up vaccines to those with underlying health conditions. But again, the availability of those appointments will continue to be very limited until the supply increases. The good news and encouraging news is when the supply increases, we are well positioned. With some 30 sites around the county, we can do significantly more doses each day than what we're doing. And so as those supplies increase, we're going to be ready to make more appointments available immediately and get more shots in arms. But again, we encourage and continue to ask for everyone's patience as we go through this. I also wanted to share, we did sign an MOU, Memorandum of Understanding, with the state of California around vaccine allocation. This is the arrangement between the state, Blue Shield, which is the third-party administrator, and the county. It's essentially memorializing the arrangement we have now, where we collaborate, we work together on allocations. The county retains the ability to sub-allocate and move those doses around to meet the need. And so we are encouraged by that. We know everyone shares the exact same goal. How do you equitably get as many shots in arms as quickly as possible? And so we will continue moving forward as we have before. With that, let's jump into our charts for today. The first chart here, you will see in 1 second here, is just the dashboard for our vaccines. Again, you see there we're over 1.3 million doses administered. And you can see how right at the margin we're running here. You see basically just 100,000 more doses received than have been administered, 6,000 pending documentation, and those to be administered are upcoming appointments that we have. And so we really are running right at the margin, which was again the goal and the aim, was as quickly as we receive them to get them in arms. And so some of those to be administered represent vaccines that we hope will be coming early next week and been conveyed to us. They will come. But again, we're approaching the 30% of San Diego County residents eligible, 16 and older, receiving their first dose, 27.7, and 17.5 have been fully vaccinated. We have not yet received any additional J&J vaccines. We are hopeful that we will soon, because we know that can help us get to residents fully vaccinated a little bit quicker. What is scheduled to receive next week is a combination of Pfizer and Moderna. Next slide, please. Here you'll see the last few days, a slight uptick in the number of cases, but I think it's really important to point out that the percentage of positive is remaining the same on those days. It is an uptick in testing, but it still remains on those days about 3% percentage of positive, which you can see right there, which is right at our 14-day rolling average of 2.8. So a little uptick that we see. It's a reminder for folks to continue to be cautious. Obviously, folks are out and about and doing more things, and we still really encourage San Diegans, utilize the mask, avoid the high-risk settings, maintain physical distancing. Let's continue a strong recovery. Next. Loss of life, again, every life is important. It's counted. 8 is what we were reporting today, 8 yesterday, 10 the day before. And you can see, unfortunately, we are approaching the 3,500 number threshold. And so, again, a reminder of what is at stake and why we all continue to do what we need to do to remain safe. The next slide here will just walk you through, again, the descending case counts. We dropped under that 7 total, 6.8 unadjusted and no change in the adjustment factor. Our testing positivity percentage is encouraging. That is in the orange tier, as is our health equity testing positivity percentage. The only real impact of us going to 6.8 is on youth sports. It lifts the requirement that they have to do testing, but we obviously want to keep this low, and we would like to see this number continue to descend. But this is a great credit to San Diegans taking action, to the impact of the vaccine being present here, and again continues to reflect positive momentum and trajectory as we move forward. The next one here just shows how rapidly we have descended, and you can just see the real progress that we've seen just since the beginning of the year, where we were compared to where we are, and obviously we're hopeful that these trends continue as we move forward. And then finally, just to reiterate, the red tier is where we are now. The changes, restaurants indoor at 25% capacity or 100 people, whichever is less. Zoos, museums, and aquariums indoor at 25% capacity. Retail can now go to 50%. Indoor gyms at 10%, and movie theaters, again, similar to restaurants, 25% capacity or 100, whichever number is less. So with that, let me turn it over to Vice Chair Vargas, and then we'll get to your questions. Thank you.
Thank you, Chair Fletcher. I want to start today by reminding everyone that just last month we did a call to action, and because of the effort to vaccinate everyone is not something that government can do alone, we asked every citizen, community and business organization, and members of the media to work in partnership with us. Today, I just want to thank everyone who has helped their neighbor, their parent, their grandparent, their friend to schedule an appointment. To every community organization on the ground helping to schedule appointments for the most vulnerable, to the business organizations who have worked with their members to encourage employee vaccinations, and our media partners who have provided correct vaccine information to everyone who has taken a pledge to get vaccinated when it's their turn. We really appreciate you. In particular, I'm really proud of the South region. As of today, 95.3% of residents 65 and older have received at least 1 dose of the vaccine. Now, with more eligible groups, we continue to ask for the community's help to get everyone vaccinated. Our cases in San Diego are decreasing, and as more people are getting vaccinated. Also, just a reminder, because I've gotten this call a couple of times, if you are eligible under this new phase due to any underlying condition and you are younger than 18, the Pfizer vaccine is the only vaccine available for this group. I wanted to make sure we remind everybody of that. Ahora quisiera darles las gracias a todos. Quiero recordarle a la comunidad esta tarde que la fase 1 ya es elegible para recibir la vacuna. Esto significa que las personas de edades 16 a 64 con condiciones médicas de alto riesgo y discapacidad pueden acudir a un sitio de vacunación para recibir su vacuna. Este grupo incluye a personas de 16 años o más que tienen enfermedades graves como cáncer, enfermedad renal crónica, enfermedad pulmonar crónica, condiciones cardíacas, diabetes, obesidad, hipertensión y entre otras. Pueden ir al condado, a la página web del condado, y la información está para ustedes para que la puedan ver. Las personas que son elegibles no tendrán que mostrar documentación de su enfermedad, pero se les pedirá que firmen una autodeclaración que cumple los criterios. Quiero enfatizar que los jóvenes menores de 18 años que sean elegibles para recibir la vacuna solo pueden recibir la vacuna Pfizer. También quiero mencionar, porque hemos recibido muchas preguntas, que en la plataforma MyTurn también pueden hacer las citas disponibles, pero ahora van a haber vacunas en las farmacias. Eso significa que ya no está limitado a solo el programa de citas dentro de los sitios de vacunación del condado, sino que ya tienen la alternativa de hacerlo en alguna farmacia también. Queremos darle las gracias a todas las personas que nos han ayudado a que las personas se vacunen, por lo cual hemos entrado ahora al nivel rojo. El día de ayer el condado de San Diego ingresó al nivel rojo. Eso significa que establecimientos como gimnasios, cines, tiendas, iglesias, entre otros, podrán abrir a cierta capacidad con modificación. Por ejemplo, los restaurantes están reabriendo con el 25% de comedor interior, gimnasios con un 10% de su interior, cines, museos, acuarios con un 25% de su interior. Esto se debe a que el Estado de California ya logró vacunar a 2 millones de personas en áreas del Estado que han sido afectadas por el COVID-19. Esto significa que no debemos de bajar la guardia. Todavía hay muchas personas por cual vacunar. Les pedimos que sigan usando sus cubrebocas, mantengan distanciamiento social cuando sea posible, lavarse las manos frecuentemente y vacunarse cuando sea su turno. También les agradecemos a todas aquellas personas que han ayudado a sus vecinos, a sus familiares y amigos en programar sus citas para la vacuna. Aquellas organizaciones comunitarias, cámaras de comercio y los medios que han ayudado a compartir el mensaje de la importancia de las vacunas, les agradecemos sus esfuerzos y les pedimos que hay que seguir trabajando juntos. Hemos logrado ya casi 1.3 millones de dosis de la vacuna que se han administrado en nuestra región. Y estoy muy orgullosa que en la región del condado del sur de San Diego hemos logrado que el 95.3% de las personas de 65 años o más han recibido al menos la primera dosis de vacuna. Seguiremos nuestros esfuerzos de seguir abogando por más vacunas y le pedimos que sigan teniendo paciencia mientras llegan más vacunas a nuestra región. Muchísimas gracias.
Thank you, Vice Chair Vargas. And I want to commend everyone involved in helping us try and increase the availability of vaccines, particularly in the South County. Supervisor Vargas, the team, the community health partners, the fact that more than 95% of seniors in the South region of the county have received at least one dose, I think is a testament to some incredible work that's been done. So thank you. With that, let's jump into our questions for today. We'll start with our call-in questions.
Our first caller is Jennifer Kastner with 10 News.
Hi, this is Jennifer Kastner, ABC 10. Thanks for taking the call. This question has to do with the county's program to get vaccinations for homebound seniors. In early February, Supervisor Fletcher, you announced that people could start calling 211 to get on a list and that they would be notified about setting up an appointment. But that was almost 6 weeks ago, and now we're hearing from homebound seniors who say that they still haven't been able to get vaccinated. And they still can't get clear answers from the county as to why. And meanwhile, lower priority tier recipients are now being vaccinated. Can you explain to us what the delay is?
Yeah, this program has been challenging. There's a lot of difficulties involved, both in terms of these individuals generally have underlying health conditions, and so the teams have to stay on site much longer. There's also been challenges with the transport of the vaccine and what's required in terms of storage and availability, and a team, it often takes more than 1 hour to do one individual and then move to another. We did have a provider on early when we announced the upstart of the program. That provider did about 3 dozen vaccines and then came to the realization they could not continue. And so we've had to pivot, and we presently are doing those with our Operation Collaboration. Our mobile teams are doing them, and Sharp Healthcare has come on board. They have 4 to 5 teams that are out today that are doing these. They're utilizing the J&J vaccine now that it is available. And so we're trying to get it back on track and moving a little bit faster. The other thing is you have to screen the individuals who are on the list to make sure that there's not another way they could get vaccinated that would be quicker and prioritize. One thing we did do is focus on all of the caregivers for these individuals so that a homebound senior, while we're increasing the speed at which we can do this, is working to do everything possible to ensure that caregiver in the home has been vaccinated, and we do think that program has been generally successful. So short answer is it's a very challenging situation. It's very difficult. We had a couple hiccups, but we think it is back on track and moving much more smoothly, and hopefully we can get through those individuals. Again, understanding the significant amount of time it takes just to administer a single vaccine for individuals, but we are working hard to try and address it and try and get it sped up, and we ask for folks' patience.
Thank you.
Thank you.
Matt Hoffman, KPBS.
Hi, I know going to the red tier means a lot of more schools can reopen. I know Supervisor Fletcher, you said that in regards to teachers and school staff that they had been offered first appointments. Can you just update us on vaccinations for teachers and school staff, like how many have been done, how many are still outstanding?
I'd have to check with San Diego County Office of Education and VIBA to see how many they've done. I know they've been offered. I believe perhaps 2 weeks ago they had gotten through offering them to all K through 12, both public charter and private. I don't know how many have taken it up, but again, all we can do is offer it, and we'll continue to offer it as we move forward. So I'm not sure the exact numbers, Matt. We could probably check with the County Office of Ed and pull that for you.
Gotcha. And I know obviously this weekend your guys' busiest vaccination site at Petco Park is closing. Why exactly is that shutting down? And did you want to keep operating that in partnership with UCSD Health there?
Well, we always knew it was closing at the beginning of April. The Padres need that parking lot, which is a good thing. I know we're all excited to have baseball back. So even when we set it up at the outset, we knew by April 1st it would have to cease operations. And so this was a part of the planned operation. They're going to see through the rest of the second dose appointments. And then we would love to continue to work with UC San Diego. They've been a tremendous partner and ally. We do continue to work closely with them on a number of other sites. And there are discussions, and we think once the supply of vaccines increases, we could essentially take that operation and place it in the convention center downtown. We don't need to do that immediately because we have plenty of capacity in the rest of our network. Even if we had a significant uptick in the supply of vaccines, the rest of the 30 sites would be able to absorb it, and at that point we could move forward with standing up the operation in the convention center. So we expect that will be moved into the convention center, but again, we want to wait until the supply of vaccines actually increases and give them time to finish second doses that they're doing at Petco Park now.
And then just one quick clarification. Did Supervisor Vargas say 95% of South-based seniors have gotten at least one dose, or is she talking about county-wide? I know
Yeah,
a couple
it's
weeks ago,
the South
you guys mentioned
region.
70.
So the county is broken into regions. So it's in our South region, at least 95.3% of seniors have received at least one dose.
Thank you.
Thanks, Matt.
Jonathan Wosen, San Diego Union Tribune.
Hi, a couple of questions about the county's MOU with the state. Supervisor Fletcher, thanks for the update that we've signed that. Could you speak to what it was that finally made us comfortable doing that? Was it a matter of wanting to sign an MOU with the state versus a contract with Blue Shield as a private company? Was it something about the exact terms? You mentioned that the county will still be able to sort of redistribute vaccine internally. I had seen a previous version of the MOU saying that basically the county shall not reallocate or redistribute. Was that part of a negotiation to get that to your liking? And then just a bigger picture question, my last question. Is this a partnership that we feel that we need? We've spoken about San Diego doing perhaps the best job in the state of vaccinating its population. So do you feel this really addresses our needs here in terms of our vaccine rollout?
Yeah, I think, Jonathan, in large part, all of us have the same goal, which is equitably getting vaccines administered as rapidly as possible. And that's the goal of the county, it's the goal of the state, it's certainly the goal of the third-party administrator, Blue Shield. And I think we have an arrangement now that is working well. And so I just think there were discussions around, just helping them understand the unique circumstances that counties face, our need to be able to be flexible, to be able to be adaptable, and really that need to make sure that it's a collaborative process, that we're working together. And so, we just worked through that process. We didn't have the contentiousness that other counties had surrounding this issue. We never received a contract from Blue Shield to sign. And so it wasn't like we didn't reject anything. We just, all parties kind of talking together. And it just came about that the easiest way to memorialize what we've been doing and what we'll be doing moving forward is just an MOU with the state. And again, I don't see any significant changes signing the MOU from what we've been doing. Collaboratively working together on the allocation, with the county retaining the ability and flexibility to sub-allocate and move vaccines around. And so I think, the primary problem with the vaccine process, there's been a lot of little challenges and issues, but the primary problem has been a shortage of supply. And we think that supply will increase, and we think we will continue to get allocated vaccines and continue to have that ability. So we feel good about where we are. We feel good about where we're headed. And now we just have to focus on waiting for the increase in supply to be able to administer more.
Okay. And was the ability to sub-allocate something that had to be negotiated that wasn't?
Yeah, that was important. And I don't think we never. I think once you walk through and explain a unique circumstance that pops up where you need to do that, along with the daily effort that our staff and team go through in shifting allocations and moving Moderna from here to there and moving Pfizer here and what we do with J&J. I also think that San Diego is unique in regards, and I don't know for certain other counties, but we have a very collaborative approach with our healthcare systems. We are working together. We have pods or super stations with almost every one of our healthcare providers in San Diego County. We're on the phone talking. We're constantly in communication. We're really working well together. And so I think in large part the system, the way it's been running, again, we have a shortage of supply, and we have little things we have to tighten up, homebound seniors, I mean, things like that. But in general, the structure of the arrangement has been working reasonably well, and I think the MOU just kind of puts that in place and provides some additional guarantees of flexibility for us, and I think it'll remain a very collaborative process working together as we move forward.
Thank you very much.
Thank you, Jonathan.
Alexis Rivas, NBC7.
Hey, so I know last week we did a story on how people who had suffered type 1 diabetes and also from hypertension were not initially eligible for that phase 1C for anyone between the ages of 16 and 64 with some underlying conditions. But that's since changed, and I've checked it this week and see that type 1 diabetes is on the list, hypertension is on the list. I think immunocompromised states, like that category has broadened. Asthma is on the list. What prompted kind of adding these additional underlying conditions?
I'll have Dr. Wooten speak to that.
Good afternoon, and thank you for that question. Last week, after checking with the CDC's website, it did include those categories, and we wanted to include them as well. And ultimately, the state on Monday included those categories. So those categories have always been identified by CDC. The first, the overall category that was originally on the website was these conditions are associated with health conditions or underlying medical conditions that could cause severe complications if you were infected with COVID-19. The additional list that we added last week, these conditions might be associated. So that was the difference between the two categories. Thank you.
And then if I could just ask another question. So, outside of supply, which you say is out of your control, is there anything else? I know there's a lot that, you guys say there is to be proud of here in San Diego in terms of how quickly we've been rolling out the vaccine. Outside of supply, which is out of our hands, is there any other areas that you think we could be doing better at?
Well, I think we have to continue to be very mindful of equity in terms of making sure the hardest hit communities have access to it. And we are doing a lot around that. Our community health workers that are out engaging folks is an important component. Our mobile teams going into those areas that's hardest hit is an important component of that. Our neighborhood sites that have walk-up locations, but only for those surrounding zip codes, are certainly a part of that. Our Homebound Seniors program, we're working really hard to get more folks into that, to catch up that program and get ready. And then we want to continue to refine to make it more convenient, to make it can be easier to find vaccines. And I think we recognize right now we're at a place where, with all the underlying health conditions being opened up regardless of age, there's a significant number of folks that are going to be seeking appointments, and we don't have enough. And again, that is a supply issue, but we ask for folks' patience. We do anticipate soon, hopefully very soon, really significant upticks in supply. And so when that happens, we have the capacity right now to do significantly more per day than we're doing, but we may have to even increase beyond what we have now, and so we're preparing for that as well. We'll have to ensure proper follow-up, tracking folks down to make sure the second doses percentages are really high. And so, every day we think about what can we do better and what more could we do and how could we do it faster and how could we make it easier. And I think as we go through this, every day we're going to continue to look for ways to refine the system and make it easier. But we're incredibly grateful for the collaboration of our healthcare partners. They've been wonderful allies in this, and we're very appreciative of them. And then we're very appreciative of the public, who's endured a lot. It's been a long year, and then you throw into that the difficulty in getting appointments because they're so limited, some of the challenges we had with shipments and second doses, and we just really appreciate the patience and cooperation of San Diegans, who I think know and recognize we want everyone to get vaccinated as quickly as possible, and we're doing everything we can. So always areas we can improve, and we'll always look to do better, but I think generally as a county, we're headed in a good direction.
When you say supply to increase,
Uh-oh. Did we lose her? Did we lose you?
well, okay,
Oh, hold on, you're
Yeah,
back. You're
I'm
back.
back.
Okay, go ahead.
I've resurrected.
What was that?
I don't know. I've resurrected from the conference call, oblivion. But just one quick. You had mentioned the significant supply you think is going to increase very, very soon. Can you just are we talking weeks?
Yeah,
A month
I mean,
from now?
I would just be speculating. Here's what I can tell you. When the President of the United States says every American will have access to the vaccine in May, well, that tells me if we're going to do that, then at some point at the end of March, we should sure see supplies increase. And so I just know that there's been such focus and attention on increasing the supply of vaccines that at some point that has to start materially impacting how much we get each week. We also got a small little chunk of J&J. Those have got to start increasing as well. And so, the pace at which we're going is not the pace that can be sustained if the goal is to make it available to everyone in May, which means it has to increase. And we're frequently told next week it's going up, and it did go up a little bit. We're about 9% more this week than what we're getting next week versus what we got for this week. All right, that's better than flat or better than descending. But we continue to be conveyed, prepare for larger and larger increases. And so we don't know when that'll be, and it would really be irresponsible to just speculate. It's just got to happen soon, and I think when it does, we're well positioned to be able to really open the spigot and go fast.
Thanks.
Thank you.
Our next caller is Ashley Jacobs with Fox 5.
Hi, good afternoon. Thank you for taking my question. I just have noticed, since we've moved into the red tier already, there seems to be this sense of excitement in the air. People are starting to make plans again and very excited about doing so, and that includes traveling for spring break. Are there any concerns from your point of view or anything that you want San Diegans to keep in mind as they prepare to travel, or the risk of people from other states coming now that our beaches, restaurants, and more attractions are opening?
Well, it's COVID. We're always concerned. We've been doing this for a year through ups and downs, and what we hope is that excitement, Ashley. We hope that excitement is around descending cases and increasing vaccines. And so if that's our excitement, we want to continue to be excited, which means we want to continue to be safe. We don't want to see a big spike in cases and what's happening. And so, we just hope we've come so far and we're headed in the right direction. And we do have a greater ability to get out and do some things we enjoy. I had the ability this weekend to go watch my kids play baseball, and we did it safely and we did it responsibly. But we want people to continue to do that safely and responsibly. And if we do that, then I think we can have a smooth, steady recovery as we come out of COVID. And so that's where we continue to hope. But, every one of these holidays and special events and occasions is always a concern. Thanksgiving was obviously caused a real problem. The Super Bowl, not so much. And so we're hoping as we move forward that we're in that situation where some of these occasions are not so much creating a problem or a spike. And again, we're going in the right direction. Let's just see it all the way through and continue to do really well as a county.
Okay, great. Thank you so much.
Thanks.
Our next caller is Brandon Lewis with CBS 8.
Thanks for taking my question. It seems like some of the anxiety about the second dose has passed. Do you have any data now, looking back, how many people got their second dose on time or actually ended up going beyond that 42-day window?
I don't, Brandon. We could check and see. I think folks got it. You have a little bit of flexibility there. You certainly don't have to restart. And so, we do think that a lot of that has been worked out. And in some regards, the last few weeks have been frustrating in one way, in that we haven't seen the increase in vaccines we want, but we have seen some consistency in stabilizing, which has helped us be able to catch up those second doses and creates less of a boom-bust effect as we move forward. And so we feel reasonably confident, again, things can always change, that we're unlikely to see that same strain or stress on second doses as we move forward. But I don't know exactly how many have done it. I know the appointments are now being made available for everyone to get their second dose, and hopefully, as we work our way through this, that'll continue to be the case. You always worry a little bit that you get irregularities in one versus the other, and so you get a backlog of a lot of second doses for one vaccine, but you're getting supplies of the other. But we're going to keep working through that, and hopefully if supplies continue to increase, we'll be able to manage that well.
Okay, thank you. And then for Dr. Wooten, in the public health officer's call with the state, were there any concerns expressed that the list of conditions is too broad given supply? And, for example, more than half the county alone qualifies because they are overweight instead of just obese as the original category stated.
So for that question, as I stated before, the CDC had listed both categories on their website. The state initially just included those conditions that are associated with increased risk of complications or severe illness from COVID-19. The additional add-ons are those conditions that might, and we wanted to give all individuals the opportunity to have access to the vaccines that needed the vaccines, based, again, on the recommendations from the CDC. Whether it's overweight or obesity or severe obesity, there's also type 2 diabetes versus type 1 diabetes. All of these are underlying conditions that could place one at increased risk from complications if they contract COVID-19. Thank you.
So it's appropriate then to have them in this category and not do the first and then come back to folks maybe like type 2 first and then type 1?
I don't understand. Can you repeat?
I was just saying that, so in your opinion then, is it appropriate to do them all together right now as opposed to doing folks who have maybe type 2 diabetes and then doing people who have type 1?
Well, who's to wager that type 2 is worse than type 1? People that have type 1 type 1 diabetes might be at increased risk. It's an underlying medical condition, and for any given individual, if you compare the two, you could be more severe with one than two. Those are just recommendations from the CDC, and we wanted to include all of the recommendations so that individuals could see themselves on that list and get a vaccination if possible. Thank you.
Our final caller is Paul Sisson with the San Diego Union Tribune.
Thank you. Yeah, I'd like to dig in a little more to that BMI situation. As far as I can tell, looking at the state's website today, I don't see where they've added the additional conditions that San Diego County has added. And as was said, the BMI recommendation state is for those with body mass index of 40 or greater. San Diego's is 25 or greater. I reached out to the county earlier today and asked for some statistics on our local population by BMI. It looks like going from 40 to 25 adds about 1.2 million residents to the pool of people who are currently now eligible to be vaccinated. That's about a third of our population. And these are 2019 numbers before we all were home for a year stress eating in our houses. So I just wonder, if there's a worry there that bringing this many into the fold all at once might crowd out the people who say are at that severely obese level where, they definitely would probably be at significantly greater risk than somebody who was at a 26 BMI and just considered overweight.
So, Paul, no, I have no concerns. What you're looking at is the obesity in isolation. That 1.3 million that you've identified, they may have other conditions that have already placed them in categories where they could get the vaccine, like being 65 and older, for instance. So we cannot look at the numbers for individual categories or groups in silos. There is a lot of overlap. So again, I have no concern. Those categories are available for people to see themselves and to get vaccinated if they can. Once we have more vaccine, and we do anticipate that we will have more vaccine in the near future, people will be able to get vaccinated. But in this particular situation, I have no concern that this is going to knock another group out of getting a vaccine. So thank you.
Doctor, one other question for you. Thank you so much for that answer. This has to do with going into the red tier and now having indoor capacity open up in restaurants and gyms and other locations where people can now do indoor activities. We know that folks who are not vaccinated still stand quite a risk of spreading this disease indoors if they're not wearing their masks and so on and so forth. And I wonder, do you think people who have not yet been vaccinated should be out eating indoors, or should they wait until they're vaccinated?
Well, of course, if individuals that are not vaccinated, we want them to still follow the guidance that have been administered. And this includes being in gyms or being in restaurants. We want as many individuals to get vaccinated that follow the prioritizations that we've had. And if people have not been vaccinated, they are going to have an increased risk for contracting the illness if they are interacting with large groups. So we tell on our website and even with the new guidance that's come out by the CDC, whether you've been vaccinated or not vaccinated, we want people to avoid large groups. So that has not changed at all. And we are concerned if people do that, and we encourage you not to. So our recommendations still stand. Thank you.
All right, we'll now go to our text questions.
This question is from Jennifer De La Cruz with ABC 10 News. Her question is, the County Office of Education says they're seeing low numbers of teachers using the Viva portal to get vaccinated. If the demand isn't there, how long will the county keep holding 20% of vaccines for teachers?
Well, we don't hold 20% of vaccines for teachers. We make available 20% if there are appointments that are needed. And so we fill the need of the appointments up to 20%. And if they aren't taken, then we redistribute them in the entire system. So we're not sitting on or holding any of them. And so we'll continue to meet their needs based on the appointments they schedule, again, up to that threshold.
Okay, this question is from Jared Ahrens with ABC 10 News, and he's asking for both Dr. Wooten and Chairman Fletcher to answer. Israel recently instituted a green passport program where proof of vaccination is required to enter many community settings. The EU is also considering a similar program to allow travel between countries. What are your thoughts about having something similar in place here?
I think it's great, and I would hope the United States would replicate what Israel did and what the European Union has done. I think it could be of great utility and value, both in helping facilitate some safe interactions with folks. But I also think a program like that, when we get to a day of plenty of vaccines, might help encourage or incentivize some folks to get vaccinated that otherwise, may not want to go through what they perceive as a hassle of getting vaccinated. So I would certainly hope the United States as a country would follow that model. I think it could be of great utility and great value. That's my thoughts. Let me ask Dr. Wooten if she has anything. Dr. Wooten says she doesn't have anything different.
Okay, this question is from Claudia Bucio with Univision. This is for Dr. Wooten or Dr. McDonald. Number one, and there are three questions. Number one, are there public health concerns over outbreaks due to upcoming spring break travel, given that San Diego is a tourist destination? Could we see numbers rise like they did during Thanksgiving and Christmas?
Thank you for that question. I think as Chair Fletcher has stated already, anytime there's a holiday and people are gathering, if they are not protected via vaccinations, then there's always the potential and the possibility that they could become infected, come back home and infect others. So obviously, we are obviously concerned about this type of practice or activity in the public. So yes, it is a concern, and we hope people, again, will follow the best practice measures Again, washing your hands, watching your distance, and wearing your face mask. And if you're sick, stay home, get tested, and again, when it's your turn, get vaccinated. We will continue to promote those strategies as a way to be COVID safe.
Dr. Wooten, do you mind staying up there for a minute? Her second question is, Florida is planning to announce a reduction in the age requirement, which means they have vaccines. Why is it that California, and more specifically San Diego County, is struggling with vaccine availability?
Well, this limitation in the supply of vaccine is not just a California and San Diego issue. This is an issue all over the nation. I'm not sure exactly what you have just stated is San Diego and the state of California has decreased the age 16 to 64 with high risk. The next group would be the last group, which is anyone 16 years of age and older. So I don't think that Florida is really doing anything differently than we're doing.
Okay, thank you.
Okay.
And this next question is for Supervisor Vargas, and they're hoping she can respond in Spanish. What message do you have for the community now that businesses are reopening? Many are eager to go back to normal, but not everyone is vaccinated.
Bueno, la pregunta es específicamente qué información le podemos dar a la comunidad ahora que los negocios van a estar abiertos, ¿verdad? A un nivel más pequeño. Pues más que nada es que hay que seguir la guía de la CDC. Es importante que las personas que aunque hayan recibido su vacuna, que todavía sigan usando sus cubrebocas, que sigan estando 6 pies separados, que hagan todo lo posible por estar solamente en sus núcleos, ¿verdad? Y es importante, pues, lavarse las manos frecuentes y cuando les toque su turno que se vacunen. En realidad no cambia mucho la situación, más de que ahora sí podemos ir a los lugares, pero con mucha cauteleza, por favor. Gracias.
That concludes our media briefing for this week. We will, of course, continue to post daily updates on all the relevant information and look forward to joining you all again next week. Thank you.